Are there different staging technologies that may be unique to HIV/HCV co-infected patients?
So persons who have both HIV and hepatitis C also need liver disease staging, just like individuals with hepatitis C monoinfection. And what's interesting is that nearly all of the tests that can be used for persons with hepatitis C alone also apply for individuals with co-infection. And so in particular, blood tests like the APRI, the fibro test, which in the United States is often called the FibroSure, the elastography, all of those methods that have been, and the FIB4, which is another blood test, all of those methods which have been both tested and validated in monoinfection have also been shown to be useful in co-infected individuals. The principal difference when you think about someone with co-infection is to be aware that there's an increased risk that they have advanced disease or cirrhosis. And so the progression of liver disease is greater, and therefore the tests need to be interpreted that way. Your, if you will, expectation of advanced liver disease is higher, and therefore your likelihood of finding a person with cirrhosis is greater, and when you expect that, your so-called pretest probability is higher, and that does affect your interpretation of tests. So let me say something else about that. If you have a person on one extreme who's a 18-year-old girl with hepatitis C for a year, you don't expect there to be cirrhosis, and so you're going to interpret any test that suggests that with a high degree of suspicion. In contrast, a 60-year-old HIV co-infected man who drinks a lot of alcohol, you're going to expect cirrhosis, and if you get a result of a test that's consistent with cirrhosis, then you're going to be more satisfied with it and more likely to accept that test result.